Hi, I'm Dr. Deepak Shedde. Welcome to the third of my capsules on polycystic ovarian disease. Today we'll be looking at why do you get polycystic ovarian disease. If you know your enemy, you can defeat it. This statement comes from The Art of War. Of course, it's much larger than that. It usually says that if you know your enemy and yourself, then you have a good chance of defeating it. But if you don't know yourself, neither do you know your enemy, you'll not win. So it's very much true even in healthcare. You need to know what you're dealing with. And in polycystic ovarian disease, we're actually dealing with insulin resistance. Normally, all our cells in our body require insulin, which is a hormone, to digest or to take up glucose, which we imbibe when we eat food. In people who have a tendency to develop polycystic ovarian disease, for some reason, their cells genetically do not take up insulin and glucose together. So the hormones which control your ovulation, for some reason, are affected by the high levels of insulin and the higher levels or longer levels of glucose in your bloodstream. And this is genetically determined. There are some medicines which we'll be looking at later on in other capsules, which may help to make our cells a little bit more sensitive to insulin. But intrinsically, we cannot change the insulin resistance of our cells. But we can do the next step. If we stop the glucose or carbohydrate, then automatically the insulin level drops. Stop your glucose and insulin comes down. Insulin comes down, the cascade unravels, and you got ovulation. Once you got ovulation, then most of your problems are solved. So if you decrease your intake of carbohydrate, you'll probably lose weight, which is not so bad. But more importantly, your insulin levels will come down and your hormone levels come back to normal. And there goes your polycystic ovarian disease. Please remember, these capsules are purely health information and are not a substitute for a visit to your doctor. In the next capsule, we'll be looking at the treatment of polycystic ovarian disease. As always, please click like, please subscribe, and please put in your comments how you may expect me to improve on these health capsules. I also would like suggestions on, once I finish with this PCOD, what other health areas you would like me to cover related to women's health. All right, so I'll see you soon in the next capsule where I'll be looking at treatment of polycystic ovarian disease. Bye.